Welcome to Nursing Online Education. Mask-like face is related to which disease? Option A. Cushing syndrome. Option B. Marasmus. Option C. Parkinson's disease. Option D. Down syndrome. And the answer is Parkinson's disease. Next question. The most accurate way to determine the need for oxygen in a patient with COPD is by Option A. Observing the skin color. Option B. Nothing changes in the vital signs. Option C. Asking how the patient feels. Option D. Blood gas analysis. And the answer is blood gas analysis. Equivalent sign is seen in Option A. Appendicitis. Option B. Cholecystitis. Option C. Pancreatitis. Option D. Cirrhosis of liver. And the answer is pancreatitis. The log rolling of a patient done in case of Option A. Rib fracture. Option B. Clavicle fracture. Option C. Femur fracture. Option D. Spine fracture. And the answer is spine fracture. Which content present in breast milk that protect the baby from malaria? Option A. Lysozyme and LGA. Option B. Bifidus factor. Option C. Lactoferrin. Option D. Para-aminobenzoic acid. And the answer is para-aminobenzoic acid. The second most common cause of MMR in India. Option A. Hemorrhage. Option B. Infection. Option C. Unsafe abortion. Option D. Obstructed labor. And the answer is infection. The first most common cause of MMR in India. Option A. Hemorrhage. Option B. Infection. Option C. Unsafe abortion. Option D. Obstructed labor. And the answer is hemorrhage. The major neurotransmitter that is responsible for sleep is Option A. GABA. Option B. Serotonin. Option C. Dopamine. Option D. Acetylcholine. And the answer is serotonin. The World Breastfeeding Week is celebrated in the week of Option A. January. Option B. August. Option C. April. Option D. December. And the answer is August. A child who ingested 15 maximum strength acetaminophen tablet 45 minutes ago is seen in the emergency department. Which of these order the nurse do first? Option A. Gastric lavage. Option B. Acetylcysteine 4 NH per pharmacy. Option C. Start 4 dextrose with 0.33% normal saline to keep vein open. Option D. Activated charcoal per pharmacy. And the answer is gastric lavage. Here, note the point. Removing as much of the drug is the first step in treatment for this overdose. This is best done by gastric lavage. And the next drug to give would be activated charcoal, then mucomist, and lastly the 4 fluids. Which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Options are angina at rest, thrombus formation, dizziness, failing blood pressure. And the answer is thrombus formation. Here note the point. The thrombus formation in the coronary arteries is a potential problem in the initial 24 hours after cardiac catheterization, and a failing BP occurs along with the hemorrhage of the insertion site, which is associated with the first toll after the procedure. A client is admitted to the emergency room with renal calculi, is complaining of moderate to severe flank pain and nausea. The client's temperature is 100.8 degree Fahrenheit. The priority nursing goal for this client is: options are maintain fluid and electrolyte balance, control nausea, manage pain, prevent urinary tract infection. And the answer is manage pain. Here note the point. The immediate goal of therapy is to alleviate the client's pain. What would the nurse expect to see while assessing the growth of children during their school age years? Option A, decreasing amount of body fat and muscle mass. Option B, little change in body appearance from year to year. Option C, progressive height increase of 4 inches each year. Option D, yearly weight gain of about 5.5 pounds per year. And the answer is yearly weight gain of about 5.5 pounds per year. Here note the point. School-age children gain about 5.5 pounds each year and increase about 2 inches in height. At a community health fair, the blood pressure of a 62-year-old client is 160/96. The client states, "My blood pressure is usually much lower." The nurse should tell the client to: option A, go get a blood pressure check within next 48 to 72 hours. Option B, check blood pressure again in 2 months. Option C, see the healthcare provider immediately. Option D, visit healthcare provider within 1 week for a BP check. And the answer is go get a blood pressure check within next 48 to 72 hours. Here note the point. The blood pressure reading is moderately high with the need to have it reached in a few days, and the client states that it is usually much lower. Thus, a concern exists for complications such as stroke. However, immediate check by the provider of care is not warranted. Waiting 2 months or week for follow-up is too long. A client has been newly diagnosed with hypothyroidism and will take levothyroxine 15 mcg per day by mouth. As part of the teaching plan, the nurse emphasizes that this medication, option A, should be taken in the morning. B, may decrease the client's energy level. Option C, must be stored in a dark container. Option D, will decrease the client's heart rate. And the answer is should be taken in the morning. Here note the point. Thyroid supplement should be taken in the morning to minimize the side effects of insomnia. Next question. In children suspected to have a diagnosis of diabetes, which one of the following complaints would be most likely to prompt parents to take their school-age children for evaluation? Option A, polyphagia. Option B, dehydration. Option C, bedwetting. Option D, weight loss. And the answer is bedwetting. Here, note the point. In children, fatigue and bedwetting are the chief complaints that parents to take their child for evaluation. And bedwetting in a school-age child is readily detected the parents. A client comes to the treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Options are trichomoniasis, chlamydia, staphylococcus, streptococcus. And the answer is chlamydia. Next question. When teaching client with coronary artery disease about nutrition, the nurse should emphasize option A, eating 3 balanced meals per day. Option B, adding complex carbohydrates. Option C, avoiding very heavy meals. Option D, limiting sodium to 7 grams per day. And the answer is avoiding very heavy meals. Thank you.